Well, this week, the Royal Children's Hospital in Melbourne had to advise families to seek alternative care amid what it described as unprecedented demand. This is happening as another COVID wave is hitting parts of Australia. To discuss this, I'm joined by Instantscripts Chief Medical Officer, Dr. Greg Scher. Greg, thanks for your time. We're seeing this extraordinary strain on emergency departments, not just in Melbourne, but across the country. Now, obviously, if people are in need of urgent medical attention, they should go to hospital. But what are some of the other options that are available for non-urgent care?
Hi, good afternoon. Thanks for having me on. Yeah, so at the moment, you're right. There's the hospital systems are being overburdened. We're seeing, as you said, an unprecedented demand. Uh, so many children, especially at the Royal Children's Hospital, are going into the emergency department that don't necessarily need to be emergency. There are cases of children that aren't so unwell. They can be managed safely at home. So we are trying to encourage patients to seek other options, and that option is telehealth. And Instantscripts provides a telehealth service to all Australians. And the whole idea is to try and work out if these patients can be safely managed at home, to try and work out if those symptoms are not urgent, and try and go through the symptoms with the parents and reassure them that they can be safely managed, and to watch out if the symptoms deteriorate, and therefore they don't go to the hospital and add to that overburdened hospital system.
So for people who haven't had a telehealth consultation before, just talk us through how exactly it works.
Sure. So with Instantscripts, we're open 7 days a week, 6 a.m. to midnight. And what happens is the patient, whether it be if it's for a child or for an adult, they go online and they register and set up an account, and they request a telehealth consultation. What will happen is they'll be put through into a virtual waiting room and be picked up by a doctor very quickly. So this whole system is extremely accessible. It's hassle-free. It's affordable. It's quality healthcare. There's Australian registered doctors who'll be speaking to the patient, and we know now that 70% of a patient's diagnosis can be made by history alone. So you can really get an idea of how sick someone is. If they're really sick, they need to go to hospital, and you can actually manage a lot of patients. You can manage a lot of conditions via telehealth, and that can be either giving a script for someone for like an antibiotic or some other kind of medicine they might need, or providing other services such as referrals or certificates or pathology that they might need, and just giving that reassurance to a lot of people out there who are very nervous and worried.
Is there a cost saving, a government cost saving here as well? I know that the cost of treating people in hospital is extremely high. I mean, is there money that the government can save here if that burden comes off the hospital system, and even the physical GP system, if people begin to use these sort of services more?
Definitely a cost saving. We had a report, a Scher report that came out recently that did show there is an enormous saving to the government if telehealth services are utilised as opposed to patients going to the hospital system. So patients should really be trying to either get into their GP, but obviously it's hard to get into GPs at the moment because there's a lot of GPs aren't seeing respiratory problems because of COVID and other reasons like that. So they can't get into their GP they can try telehealth with their GP, or they can use services like Instantscripts. We're not trying to take away from the patient's normal GP. We're still promoting continuity of care with their regular GP. We're just trying to create this service of telehealth, which is an enormous saving because if they're able to just use this service, then the government isn't spending so much money with hospital admissions and hospital service to patients.
I suppose there will be some people, Greg, who will feel they can't get that same level of care, just on that point that you're raising there, without that face-to-face consultation. So, I mean, what would you say to them?
I'd say to them, it might be strange, they're probably not used to it. We're always used to seeing a doctor face-to-face, but at the moment, this is a really good option out there. I really encourage people of all ages to seek telehealth care, and because as I said, you can really get an idea of how sick someone is, and there's a lot we can do over the phone without having to examine a patient. You can really you can get a lot of diagnoses and manage people without having to examine, without having to do tests. And just obviously, we can also work out how sick someone really is, and we'll always encourage someone to be seen physically by a GP or in the hospital if they are, too unwell.
Well, it's good to know that that option is there, particularly when we're seeing such a burden on our hospital system. Dr. Greg Scher, thanks so much for joining us today.